If there is something that can significantly reduce the burden of disease for 8 of the top 10 causes of death in the U.S. heart disease, cancer, COVID-19, stroke, chronic lower respiratory disease, Alzheimer's disease, diabetes, and kidney disease, will it be amazing? Yes, you will get it here. This video will let you know the secret to a healthier life. Vitamin D, long recognized for supporting bone strength, is now stepping into the spotlight for its broader potential. Recent research hints at its capacity to influence everything from chronic disease prevention to improved maternal health, sparking a shift in how we view this essential vitamin. What's driving this change, and how might it affect you? Let's explore the latest scientific insights. A significant study published in January 2025 by MDPI has reshaped the conversation around vitamin D. Drawing from prospective cohort studies, this research examined long-term health outcomes to assess the vitamin's protective effects. The findings suggest that maintaining higher serum 25-hydroxyvitamin D levels, above a notable threshold, correlates with reduced risks of major causes of death, including cancer, cardiovascular disease, and infectious illnesses. To achieve these levels, the study advocates for a daily intake of 2,000 international units, 50 micrograms, for most adults, with some individuals potentially requiring 4,000 to 6,000 international units, based on factors like body weight or skin pigmentation. This evidence points to tangible benefits. Higher vitamin D levels may lower cancer mortality, decrease the progression of prediabetes to type 2 diabetes, and improve immune responses to infections. For pregnant women, adequate levels are linked to fewer complications, such as preterm births and preeclampsia. These findings build a compelling case for revisiting vitamin D's role in health maintenance. To understand the 2025 recommendations, it's useful to contrast them with earlier guidance. In June 2024, the Endocrine Society released guidelines emphasizing vitamin D's role in bone health, recommending a modest daily intake of 600 international units for most adults. These guidelines relied heavily on randomized controlled trials, which often showed limited benefits beyond skeletal support, partly due to their short-term focus. The conservative stance also advised against routine vitamin D testing for healthy individuals. The 2025 study, however, leverages prospective cohort data, which tracks health outcomes over extended periods, revealing benefits the 2024 approach may have missed. This methodological shift highlights vitamin D's extraskeletal effects and supports the case for higher doses. For instance, while the 2024 guidelines noted some advantages for pregnancy, they didn't push for increased intake or testing, areas where the 2025 research offers stronger, data-driven justification. The 2025 findings outline several areas where vitamin D may play a critical role. Cancer mortality. Elevated serum levels are associated with a notable reduction in cancer-related deaths, particularly for breast and digestive cancers. Cardiovascular health. Higher vitamin D levels correlate with a decreased risk of heart disease and stroke. Immune function. Adequate levels enhance resistance to respiratory infections and improve outcomes in diseases like COVID-19. Pregnancy outcomes. For expectant mothers, sufficient vitamin D is tied to lower rates of preterm birth and hypertensive disorders. These associations underscore vitamin D's potential as a preventive tool, grounded in observational data rather than overstated claims. The 2025 research suggests that a daily dose of 2,000 international units is effective and safe for most adults to reach protective serum levels. For some, doses up to 4,000 international units or higher may be appropriate, though the upper safe limit is generally recognized as 10,000 international units daily. Beyond this, risks like hypercalcemia, a condition involving excessive blood calcium, could emerge, potentially leading to kidney issues. Consulting a healthcare provider is advisable for those considering doses above 4,000 international units to tailor intake to individual needs. The 2025 findings signal a pivotal moment in understanding vitamin D's broader applications. With widespread deficiency affecting populations globally, adjusting intake based on the latest evidence could yield significant health benefits. This research invites a proactive approach, considering higher doses where appropriate, while emphasizing the need for personalized guidance from healthcare professionals. As science continues to refine our knowledge, staying updated and discussing options with a provider can help you leverage vitamin D effectively. This unassuming nutrient tied to the sun's rays may hold more promise than once thought, offering a practical step toward better health. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.